Hi, my name is Chris English. I'm going to show you how to put on a dorsal blocking splint. This is a splint that we use after tendon repair, specifically flexor tendon repairs. This is my assistant Jen. She's going to be helping us. These are the supplies that you need to do this splint. 5x30 plaster, one stack, which is 5 sheets folded over, a couple of 4-inch cast paddings, and usually one 4-inch ace wrap is enough. For a flexor tendon injury with the repair of the tendon on the palm side, we're going to splint this with the wrist slightly flexed and the fingers slightly flexed. We're not trying to have the wrist way flexed down or the fingers way flexed down. We're looking for just gentle flexion, maybe 30 degrees at the wrist, 30 to 40 degrees at the MP joints, and just a relaxed position at the rest of the joints here in the hand. So, like all the splints, I always start with wrapping the wrist first, and then after that, I go immediately up to wrapping the hand. So we're going to cover the entire back of the hand, and I like to wrap 3 wraps around. So there's 1, 2, and then 3. And then we're going to come back and do the rest of this. So there's 1 there, 2, and 3 there. And then we'll just continue up. And we're going to go all the way up pretty much as far as we can go here. And I want to make sure as I get to the top that I do 3 wraps right on top of each other at the very end of this. So there's 1, 2, and then 3 wraps right on top of each other at the very top. And usually I'll just come back into the middle and finish this so it's smooth and not bumpy. So I want my splint to go all the way to the fingertips to stabilize this. And the way I do that is that I add cast padding to the end of the plaster. So I'll dip my plaster now, keeping the ends of it and then squeezing out all the excess water. I'm going to laminate all the layers together and to get out any air bubbles and make it so it gets nice, and as it cures that it gets nice and solid. And then what I'll do is I'll put this down and I'll take a little bit of the cast padding that I have left over and I'll put a little padding on the back of this so that way the part that sits on her fingertips doesn't hit her with any plaster, it's just only the padding. So I'll fold this over slightly so it has a nice smooth edge on it. I'm going to bring this all the way to the fingertips. And then down the back of this, I'm going to smooth it down so it holds this. And then, usually I don't need to cut this at all. I will just start on the wrist, come out to the hand, fold and tidy this up as I go. One more time around the hand, and then just go finish it up. And then as this dries, what I try and do is just make sure there's plenty of space here so I'm not smashing the fingers in. So as it dries, I'm going to hold in here, kind of make sure the plaster is not folding over and tightening up around the pinky finger or anything, and just keep it nice and flat like this. And so you can see the angle on it. This is about the angle that I'll splint these at, just a gentle flexion angle, almost the position that the wrist will just fall into if the patient is under anesthesia. Okay, thank you.